Hello, and welcome everyone to our Vistatec Life Sciences in Focus podcast. Fascinating conversations with global life sciences experts. This is a space where we interview life sciences experts once a month, and I'm your host, Karen Tkaczyk. I am delighted to talk with today's guest, Sofía Correia, whom I've had the pleasure of knowing for several years now. Anna is a freelance medical translator and writer. So that for the first time on our podcast, we have brought a linguist to join the conversation. Anna is a model among linguists, and I am grateful that we have her here today. Hi, Anna.
Hi, Karen. Thank you for having me and for your kind words. I'm really happy to be here. And I love that you're bringing a linguist for the conversation. So I'm really excited about it.
Yep. I will add a disclaimer for our listeners
Mm.
as we get going. For people who don't know about my nonlinear career, I was also, like Anna, a freelance professional translator and editor for many years when I had small children. That's how Anna and I came into contact, and we have worked together to raise the profile of linguists in life sciences. Most recently, we worked together when Anna was one of the editors of a European Medical Writers Association journal issue on translation, and I penned one of the articles. So, Anna, please, that's enough for me. Tell our listeners a little about your origin story and how you got to where you are now.
Well, so I've worked as a freelancer since 2007. So close to 20 years now. I specialize in medical translation right from the start, but for 12 years, I also worked as an in-house translator, first at the Social Sciences Research Center and then at the Nursing School of Coimbra, where I'm based in Portugal. And that gave me a very good foundation, not just in language, but how the workflows of how the content is developed, how decisions are made, how reviewers do their work to make everything ready for publication. I transitioned into full-time freelancer in 2018, so it's around the time when my youngest daughter was born. So I've decided to go full-time freelancer, has which had always been my plan since the beginning. But I waited around 12 years. About my path is that in the beginning, most of my work was basically translation and revision. But over the time, especially since COVID, clients started bringing more of work that goes around translation. So I started doing more like content editing, like source writing editing, localization, working on the working on content that didn't necessarily involve translation, but involved more and more developing that content from scratch. So this is where I am now, because so that's why I'm now working as medical translator and writer, and I still do a lot of medical translation. That's the bulk of my work, but I also do a lot of rewriting, localization, transcreation, and basically medical writing and content development.
Yeah. Yep.
And I also work as a linguistic validation consultant for patient-reported outcomes in clinical research. So
Yes.
that's
So,
my path.
yes, for our listeners who might only have a window into a specific part of the life sciences world, like they know linguistic validation or they know labeling or they know marketing, or can you give explain some examples of content that you would work on that shows the breadth that a life sciences linguist might cover?
Sure. Uh, I think it's useful and for your listeners to understand to divide that into two types of content. So we have the regulatory content and the non-regulatory content. On the regulatory side, I as a medical translator, I work with a lot of clinical research and pharma materials. For example, you have informed consent forms, patient information sheets, protocol materials, and all the other related clinical trial documentation. I also work in core regulatory materials like the summary of product characteristics, the patient information leaflets for the marketing authorization process in my case, with the European Medicines Agency. Uh, I also work with medical devices, meaning instructions for use, labeling, like you mentioned, packaging, and the patient-facing device materials, and that's on the regulatory side. On the non-regulatory, and this is the field where I work, uh, I focus most of my medical writing work is working with materials that still need to be accurate, of course, like patient education materials, healthcare professionals, campaigns, training materials, uh, which may or may not end up being it may go through the localization workflow. So I can work on those materials, whether I am developing from scratch, usually in English, or downstream when we get to localize them. In my case, to Portuguese. So this is kind of a non-exhaustive list of the types of materials
That's right.
me and other medical translators work with.
That's right. And and obviously Anna works into Portuguese, Portuguese being her native language, and
Yeah.
linguists working always into their native language. When I was a translator, I worked into English. So my equivalent would have been that I was, for instance, doing translations of all sorts of documentation that was being submitted to the FDA
Yeah.
for, new NDAs and audits, reports, and you name it. So your locale depends affects that volume of work as well, the body
Yeah.
of work that's available to you as well, doesn't it?
Yeah.
So you are not a trained healthcare professional, yet you are a true subject matter expert in what you do. So how did you get to be an SME, and how do you? So you've mentioned a little bit of that already, I think, but tell us a little more. And how do you keep it up and grow it in, for instance, new therapeutic domains or new regulatory areas?
I think that because I'm not a clinician, didn't happen overnight. But as a linguist, I've spent, as I mentioned, nearly 2 decades inside the communication aspect, inside healthcare communication. So I've been dealing over the years with so many documents, audiences, even therapeutic areas. So it can my that path has been cumulative over the years. So I've worked on hundreds of projects over the years. I've seen the same patterns. I've built terminology awareness. I learn as I go throughout all the projects I work, and I make a conscious effort to attend events where I can understand how the different stakeholders actually think and talk. And when I mention stakeholders, it can be the sponsors, CROs, even medical writers, reviewers, local affiliates, the regulators, and of course, patients, which is one of my main uh, intended audience. And and then there's also the more conscious and more active steps that we as linguists who have been working for so many years, is that the work doesn't stop. It never stopped our professional development. So we need to be always keeping up to date. It's not just reading journals, right? Journal articles, I mean. You have to focus. For example, when I get a project that deals with a more uh, complex topic, or something that I'm not very familiar with yet, I need to make the conscious effort to make um, myself aware and more knowledgeable about that therapeutic area, about that mode of administration, method of administration. So you need to make a conscious effort for every project to improve your knowledge about that topic you're translating. And also, I think that I may be the subject matter expert for in these projects, but I'm not the medical expert. I'm there as the language and communication expert, which means that I don't necessarily have to be knowledgeable about everything in medical aspects, but I know how, but I have the the domain knowledge to convey it, to make sure that the content is clear, consistent, and usable for the person reading it. So the concept of subject matter expert goes beyond the medical and health related knowledge. Is we as language communication experts are the subject matter experts, and that's how I focus my learning learning options throughout the years.
It's amazing and a beautiful example of how a lifelong learner uh, learns every day. And lovely, lovely. I just love the variety of answers you give that show how deep and how you learn passively through reading, you learn actively through attending, through choosing to do,
Mm-hmm.
you build in research time into the projects you're doing. It's why you're good at what you do. Lovely.
Thank you.
So there must be some passion behind that, right? You can't still enjoy doing the same thing after so many years unless you're passionate about it. What makes you passionate about what you do for a living?
Oh, there's a lot of passion behind it. So first, there's the personal aspect because I live with a chronic condition. So there's the personal passion. That's something that made me uh, very aware of how every patient read every type of content and how I digest the information that I have that I need to understand. So there's one side of my passion. The other passion, and this is where the personal meets professional aspect, is that it really comes down to access and fairness, because the quality of information you receive as a patient or as a person, regardless of whether you're a patient or a healthcare professional, really shapes the decisions you made and how you process the information. So if you need to understand the diagnosis that you've received, whether you trust a treatment that the doctor prescribed you, or whether you feel confident prescribing that treatment, how you manage your condition day to day, regardless if it's a chronic condition or a other type of condition. And overall, and what frustrates me, and I've had this conversation many times, and I'll continue having it, is that in many projects, so English speaking audiences get carefully crafted content, right? Content that has been written, reviewed, refined, tested, and then everything else becomes the adapted version, right? And sometimes this adaptation process is rushed, sometimes treated as just a box to check, and it's an afterthought thought in many cases. But the people that are reading in Portuguese, in Spanish, etc., and other languages are not secondary audiences. And sometimes I feel that they are treated as such, but they are not. They are just as much patients, clinicians as the English speaking ones. They're the people having to make decisions based on information that receives. So my what this is how passionate I am about this topic, is because it's we need to go beyond the bare minimum, and everyone, regardless of the language they speak or the country they live in, is everyone deserves the same amount of clarity, usability, and respect. So, and people don't deserve less than that just because they don't speak English. So that's why. That's the level of how passionate I am
That's
about this.
a sound bite,
Sorry.
if ever there was one. Don't apologize. That's a sound
I
bite, a
get carried
beautiful
over.
sound bite, if ever there was one, about why we do what we do in the world of translation, right? We see it so often that you're quite right that the first language that the content is written in gets all the attention, and then other locales get. Can't we just Google Translate this? Can't we just, do we really need to invest all this money in making it right? Yet we all know as individuals what it feels like when we read content that has clearly not been written by a human or by a native speaker, yet it's meant to persuade us to join a clinical trial, or it's meant to inform us about how we take this medicine or use this syringe to I mean
Yeah,
millions of people are injecting themselves at home with weight loss drugs these days, right? The instructions need to be clear, and it's complicated for people to work out. And so you made that point
thank you.
beautifully indeed. um I ran up upon I alluded to AI there, didn't I? So
Yeah.
we should address that topic in 2026. So translation buyers often ask me how AI is affecting business, and I have my view from my angle. What's yours? What are you seeing in terms of AI adoption for both? Let's say for both high risk use cases like an informed consent form, let's say, and lower risk non-regulated content, perhaps the approach is different.
Uh, I think that you already said it that we cannot have a discussion about AI in translation and I don't know, in several other areas without talking about risk, right? And on my end, I see kind of a diversity of approaches. So on you can have on the one hand, there are organizations that completely restrict the use of AI and say that we cannot have AI at all here, and either either they make that decision based on concerns about compliance, confidentiality, or they just don't want to take that risk and just forbid it. Uh, but you also have teams that are experimenting with it, and some of those teams are experimenting with it and careful in a careful way, but other teams are doing it just because they feel pressured, and there's a lot of pressure nowadays to make it faster, make it cheaper, especially faster. I think it's not just today. I think it's not about cheaper; it's about how fast content is being developed and how fast we are being asked to. Uh, Not only develop the content but also have it translated and localized so it's uh, but in the middle, there's people who and teams who are seeing where it can help, generally help, make it easier, uh, and where it may create more problems that it solves. So, like I said, it's about risk, and you need to think about if this content is high risk or low risk. If it's high risk, and by high risk, I mean anything that directly impacts patient safety, consent, confidentiality. So their tolerance must be basically zero. So if it's high risk content, because if you are already aware that AI may be risky or create content that's incorrect in English, that's a language in which the LLMs are trained on. So if it produces incorrect content in English, just multiply it 10, 20 fold, and that's the kind of risk that you're taking with AI in translation. But on the other hand, for lower risk, anything that is internal, still in draft, or really early stage development, okay, you can uh, use it. You may use it to speed the process. But even in those cases, you need to make sure that it's properly reviewed by someone who knows what they are doing. So, and we as linguists know what we are doing. So you need, even if you take the AI route with lower risk content, you still need to make sure that there's human supervision. And with high risk, just carefully perform a high risk analysis. And I think that when it's this type of tools started to appear, uh, those steps have not been taken. But what I see is a shift is that I think over the past year, I think we've calmed down a bit, took a step down, step back, and even teams are being more aware of the risks that AI entails. Probably because they've been through the process of being burned, not maybe not specifically in the translation stage of that's the majority of cases being burned about um, translation errors using AI, but also in the content development. And I think that we've kind of benefit from that because teams are seeing the kind of risk that AI poses in the development, so that those errors, that risk travels to translation. Um, in those cases, if teams that decide to go ahead with full AI or more without doing this risk analysis, what I see is that as linguists are not being uh, brought into the project not for translation but repair work. So that's
The
my
repair
overall,
work.
yeah, repair
Nicely
work.
put.
Well,
Oh,
you can say it risk mitigation, but
yes.
it's
Good.
basically
Yeah.
repair work because we're repairing what has been broken by misinformed workflows around AI. So this is
Yes.
something that we also need to make everyone aware is that there's a lot of misinformation about what AI can and cannot do. And there are some things that AI can do and some things that it can't do. So it all comes out about risk analysis that every organization, every team must do. And even if an organization has no idea of how to do this, reach out to linguists, reach out to people who actually know what they are doing, and we usually tend to advise them. We don't force them to either way, but we are actually in a position that we can advise organizations and teams of whether or not and to what extent you should use AI.
Thank you for your perspective.
Yes,
Yeah.
it is my perspective
Yes.
as a linguist.
Yes. No, it's perfect. It's exactly, I mean, you could join our sales team. I'm selling risk mitigation quite a lot of the time, and there's no
Yeah.
question that when we talk to our clients and our prospects, we're balancing risk along with all the other business
Hmm.
decisions that they have
Yeah.
to make. There's no question. And that was thank you for your perspective. So our time is running out here. So before we uh, end, is there something else you would like to share with our audience? Any particular, anything I haven't asked about? What would you like everyone to know?
Um, okay. Well, maybe I'll just add that, and if it has not become clear over in this conversation, is that if don't treat language as the last step. Bring linguists, whether the translators, the editors, the localization professionals, earlier in the process. It actually helps making the workflow and process smoother. We can advise. Our work is not just about changing words from one language into another. We can actually help everything goes more uh, smoothly, seamlessly, if we are brought to to project to the teams earlier. Even when it's still in content development stage, we can advise, and it it helps improve the final output, and will and actually helps the improve the quality of the output. So
Absolutely. Absolutely. Yeah.
that's
Yeah.
what I would add.
Yes, that's a beautiful, lovely point for you to add. Thank you. Well, thank you. Thank you so much, Anna, for spending time with me today. And to our audience, this Life Sciences in Focus podcast is available on Spotify and Apple Podcasts and anywhere else you might listen, and also on YouTube if you prefer to watch it. Please make sure to tune in again next month for Vistatec Life Sciences in Focus, fascinating conversations with global life sciences experts.
Thank you. Thank you for having me.